Hi, parents. It's Dr. Michelle and Dr. Carrie here.
Hi.
And we are going to be presenting on a topic that is really important and just top of mind, especially now that we are well into the pandemic and there's been several shifts and transitions, especially with kids in the public system that they're able to go back to school, even though it may be hybrid for the time being. There's been a lot more anxiety and even depression in these kids. Some of them have gotten accustomed to maybe being remote and now they really don't want to go back to school. They've been so far removed and disconnected from each other, and it's hard to dig yourself out when you feel you're just stuck. So we're hoping tonight just to uncover mainly not just the definitions of anxiety and depression, but how they present in our young teens, but also what are the common sources, and then of course what you all can be doing. So we're gonna start off with anxiety, and just go from there.
Yeah, so anxiety, personally, I think we're seeing a lot of that at the office. Of course, both anxiety and depression are going on right now, but with anxiety, that's just kind of your body's a heightened awareness. So it's kind of almost being in that fight or flight response, that stress response. We see this a lot in kids that, they're putting a lot of pressure on themselves. Not necessarily, it doesn't have to come from the parents or school, but they want to do well. They're trying to be achievers, and try to handle everything. And it just becomes too much. Throw in, you're in school, you're not seeing your friends as much, you're going through puberty, or you have all these big life events coming up and everything's just kind of thrown at you, and they're trying their best to adapt. And sometimes they kind of get pushed over that line where they can't balance everything anymore. So it's just being kind of stuck in that stress cycle and not knowing how to handle it or not having the tools to handle it.
Yeah, and I think wanted to just just add one thing too is sometimes with anxiety it can shut you off, but there's also, I don't know what else to call it other than like high functioning anxiety, like the people that put the pressure on themselves because either their parents are demanding expectations, the college prep, all that stuff, where now can you imagine how it's been for these type of like type A like perfectionists out there, where it's like they can't even take on the stuff that they want to take on because it's
Or
not
they
there.
they don't have an interaction with like their teacher if they have a question. Like that's
Yeah.
so much harder to get those direct answers and kind of plan things out that way.
Yes. So with anxiety, that can lead into depression. It can be very separated. And so when we start to see this recognizing soft signs, even in the younger kids where they're just very high energy, that could morph into some anxiety. But when that high energy kind of runs out, then we turn into low energy. We make that shift, and that's where it seems to be. And we don't have an exact stat, but it seems to be that more of the boys, teenage boys, tend to go down that lower energy route into depression, and the girls tend to stay more in that anxiety. But it can go either way, of course. And by depression, we're talking about just persistent low moods and just like loss of interest in even the stuff that you moms and dads know that they really love and value. Doesn't matter if it's video games, it doesn't matter if it's sports or whatever the case may be, but they're tanked. They're tanked. They start withdrawing, they're disconnecting, they're less responsive to maybe siblings and parents, and they just don't care. This is such a fragile time because it's a time of self-exploration. They're trying to figure out who they are, and in high school in particular, like no one knows who they are. We think we know, we don't know anything.
Yeah.
And that will carry on. So unless we have the tools, or unless we have a sense of calm and ownership, the more stressed you are, you're not going to think straight. You're not going to be open to different techniques, because we think we know it all, and sometimes it becomes that vicious cycle. So we wanted to differentiate those two.
Yeah. And I wanted to mention too, like with depression and like how Michelle mentioned that, they lose interest in things. And right now you want to keep that communication open,
Yes.
because right now you can just be like, oh, it's because of this, look at the world right now. And yes, that's true. But there's all these other layers that these kids are going through.
Mhm.
Like, is it related to this? So having that communication with your kiddos to not is like, oh, this is normal. Well, not really.
Mhm.
They shouldn't be going through this kind of stuff.
Right. And this is a time of, with the tech, we can be connected, but in the same breath, it's forced us to become
Very
disconnected.
disconnected.
Yeah.
Yep.
So we'll go into, we want you to think of stress that Dr. Carey just talked about. There's like three categories. And so we want to break those down
Mhm.
for you.
Yeah. So we can talk about physical stress. So right now, a lot of it's posture.
Yeah.
Of course, tech is going to come up a lot in this webinar, but kiddos, I mean, they're going to be like this. They're going to be on their phones. Like, look at their setups on how they're doing school right now. If they're e-learning, like we don't want to be all kind of hunched in. Tone, posture, like
Yeah.
it's all very related. How your brain gets input from your body.
Yes.
We need that movement,
Mhm.
and having that good biofeedback from your body. So
Mhm.
physical stress, whether that's posture, growth spurts. I mean, kids are
Mhm.
still growing during this epidemic. They're not moving as much, which leads to decreased core tone. Um, and of course, we're still seeing kids are going back into sports and activities. So
Yeah.
there's little traumas there, and kids just being kids, like jumping off of, piles of snow, things like that.
Or the
We have
couch.
to kind of, yeah, look at all those physical stresses that those kiddos are going through and how that affects their body.
Yeah. And I love that because that's two sides of the spectrum. We either have inactivity, with just being on social media, video games, tech, and just that lack of movement. But then we have the flip side. So even though a lot of the sports have been shut down, some of them have continued, some are reopening, and these kids are used to playing a sport really all year round. It is such a different story from even 20 years ago when we were in school. It's like being a high school athlete is like, this is your career. It's almost like that comes first. So during growth spurts, if you're sustaining all these micro traumas and we're stressed and we're not sleeping as well as a result, your body doesn't have a chance to fully heal and recover. And so again, it becomes this vicious spiral. So physical stress absolutely can wreak havoc on your system and how you deal with stress in the future.
Mhm.
So we have, I wanted to skip to emotional stress because
That's the
that
big guy right
that's
now,
that's the
for
big
sure.
one.
Obviously, for everybody right now. The problem with the teens at this point in their lives, they know they have stress. They're recognizing it, but they
Yes.
don't necessarily know how to cope with it. Or if they do, they can start falling into maybe some negative coping mechanisms, whether that's we're looking drug and alcohol related or just outbursts and not being able to kind of level that mood. Um, there's again a lot of stuff those kiddos are having to work with at this time in their lives.
And I think one big thing that's come up even recently with one of our mom and two daughters is now that more teens have phones and now they're on Instagram and now they're playing the comparison game, or I wish I looked like that, or I wish I had that. And the thing is, their little minds, they're still very immature. So what they're seeing, they're taking that for face value, that this is how these people are, and it's a filter. And it's tough to explain that to them because then they become obsessive. And that can even think about just cyberbullying, physical bullying. I mean, these are all just really heavy emotional triggers and stressors. So we really need to empower our teens to be happy with who they are and teaching them how to adapt. And of course, we have to look at ourselves as parents. Are we walking the walk and talking the talk too?
Mhm.
So it's a really tough time to be a teen. And there was a post that we recently shared. We talk about how awesome it is to have our frontline workers and so on. We really need to give more props to the teenagers and the kids in all levels going through this. No one's ever had to do this in this way.
Mhm.
And this is helping to shape who they are. So one, it's important to recognize what these triggers are, but then how do we help pull them out of it? Because they obviously can't do it on their own. They've probably been trying and getting nowhere.
Yeah. And something to think about with emotional stress as well. Your kids are looking at you, so just kind of think of, if you're on social media all the time, if you're letting that stress you out, the kids are going to pick up on that, whether they're 5 or 6 or
Yeah,
whether they're 18, they're vibing off you. They know how you're feeling. So being open with them and just the communication is going to be huge because they're going to know if you're trying to cover something up or covering your emotions or something.
yeah.
They're very intuitive.
Yeah. And you had already touched into chemical stressors, just how teens may be trying to cope or deal with things, but food is the other one. Their home, sugar. That's like an instant like way to satiate and combat stress. And then, it can make you feeling really tired or irritable. And then again, round and round we go again. So what we're putting into our systems matters a lot, along with drug and alcohol. I know that, vaping is another big thing that's been a coping mechanism. And we also have to consider too, not just the foods that we're eating, but what are we applying on our skin? We absorb a lot of what we put on. So this is the day and age of just makeup and lotions and different things like that. And it's not enough just to change diet when it comes to how stress really just ingrains into your neurology, because that will dictate how we perceive and deal with stress in the future.
Mhm.
So we wanted to lay out just, hey, these are the categories. More often than not, it's like a combination of all of
Yeah.
them.
And I want to mention too with chemical stressors, keep in mind that does count with any medications that your
Yes.
kiddos are on too, which medications, they have their time and their place, but you also don't know how that's going to affect the kids too. Like if they have to change their dosage or anything like that,
Right.
that can affect them, one, obviously mentally, but digestive issues and just mood outbursts and things like that. You have to kind of keep that in the back of your head with all this too.
Mhm.
So let's talk about like with when you have anxiety, like how you tend to respond to stress. So when anxious people tend to get stressed out, they might have a lot more outbursts or their mood might be a lot more unpredictable because they're on that heightened awareness. It might take a little bit just for them to kind of cross over that line. So they tend to be kind of the higher achievers. They have more energy. They can fall into that negative self talk really easy
Mhm.
because they have that high expectation of themselves. So you have to, again, pay attention. How is your kid talking to themselves? They have to know that they don't have to have all that stress put on them. They have people they can lean on and talk to support them through this.
Yeah. There we go. And then on the flip side, when we are looking at more of the depressed teen, once they, that energy just kind of goes out the window, you'll start to notice it just with their grades, just they just start falling off the bandwagon, especially even subjects that came easily to them. They're just not, they just don't care. They're not putting in the effort. They have a lack of coping mechanisms. So the biggest difference with like, the younger kids and toddlers is like they don't know how to cope, and teens are just kind of starting to figure it out, but they don't really own it, so to speak. And when they become more tired and fatigued and disconnected, then their own self-esteem, just their self-worth, just goes way down. So they just become lost and they put themselves on an island. And it's so tough to be a parent, especially if they're withdrawing from you and not knowing how to help. And sometimes it's the worst when you live in their house, in the same household, because they feel like, well, you have to say these things because you're my family.
Mhm.
And when we're fortunate to be able to work with a lot of families, and so sometimes they take what we say maybe with a little bit more than a grain of salt, because we're not related to them, which is a good thing,
Yeah.
to be able to look at that, because we don't want them getting into this spiral where a very real thing is, they may be having suicidal thoughts. They may have attempted. They um, They are just feeling like they're floundering and they don't have anywhere else to go.
Mhm.
So they're looking for help. They just don't know how to
Yeah.
necessarily express it.
And we have a lot of resources. We have people we refer to, like if they need extra counseling and
Yes.
somebody in their corner that way. Because, yeah, the kids are going to be like, well, yeah, you have to say that to me. You're my parents,
Yep.
things like that. So having that outside source can be really good for confirming like how they're feeling and ways to kind of get out of that.
Yeah. So, speaking of just like mental health and mindset and things like that, just taking you through, we kind of alluded a little bit, both of us did, just like going from toddler child to teen to an adult.
Mhm.
So with children, if they're having high stress and no coping mechanisms, that's going to be your tantrums. They don't even have an awareness of stress. They just kind of react. So that part of their brain that's very underdeveloped, it's very primal. So it's just going to come right out at
Yeah.
you.
When toddlers are not
Yeah,
happy,
you
they
do.
let you know.
Mhm.
And then, yeah, it moves into teenagers, like how I mentioned before. They know they have stress
Yeah,
and
that's the
they
difference.
don't quite have those coping mechanisms yet, or a vague notion of them. As opposed to like when you go into the adult side, yes, we know we have stress. We know that we have resources and mechanisms to help cope with that stress, whether you choose the right way to do that or not. So it's a progression of learning as you get older.
Yeah, and one of the questions that we ask all of our family members and teens is just what are two ways that you counterbalance stress, even if they're not stressed? I mean, I think it's good to know what those are, or some are just like, I don't know, I just kind of push through.
Mhm.
Well, that is a coping mechanism too, pushing through, because it's not an effective one.
Not
So
good long term.
no,
Yeah, it'll
no.
catch up with you eventually.
Yeah.
Yeah.
So this is where we enter in. This is our area of expertise when it comes to chiropractic care, and how could chiropractic possibly
Mhm.
help or influence, a teen and their mindset and just how their neurology is working.
Yeah.
And
So
yeah, go ahead.
I was just gonna say, like, for some people, they think of chiropractic, they're like, how can like cracking bones help your mood? Like, what's going on there? So it's almost kind of a shift in how we look at chiropractic because we're kind of neurologically based. So every adjustment that we do affects the nerve, spinal cord. It affects how the brain functions. We actually have some really cool research out there showing how the adjustments kind of affect the prefrontal cortex and logic and emotions and things like that. But with chiropractic, we can actually focus in more on your parasympathetic nervous system,
Mhm.
which is the side of your nervous system that deals with kind of rest and digest, relax, calm. And then the sympathetic side of your nervous system, which is more kind of your fight or flight, that heightened stress, that protection mode. So with chiropractic, with specific adjustments, we can go in and help kind of calm that nervous system
Mhm.
down. So it just kind of it settles everything.
Yeah, it's kind of like a pattern interrupt. So
Yeah.
it's like um, just like shorting the circuit, so to speak, because you have to pattern interrupt. You have to stop what's currently going on so that you can start establishing better patterns that your body and your brain and your body want, because that sets the stage for how you interact with things in the future.
Mhm.
And awareness is key. It's important to recognize what the stressors are, and then just focusing on one thing at a time that you can change, because it can be overwhelming. Just with the tech alone, society, it's overwhelming already. So people don't know what order, what to start with. But if we can like just focus in on the foundational piece and just make sure that that brain and body are communicating as effectively and as efficiently as it can, then we have better, our bodies are going to be more open to other therapies, diet changes, different things like that. So
Yeah.
laying that foundation is so crucial.
Like Michelle said, it's the awareness because a lot of times, like she said, it's a pattern.
Mhm.
So teens, even adults, have been this way for so long, they forget almost what it's like to have that calm. So once we get in there, we start adjusting, they're like, wow, okay, this is kind of what it feels like. It's almost like we're cracking open that window so other things can kind of come in and be more
Yeah.
accepted with that.
And we have found too, just with our teens, our young adults, especially, if you think about what people gravitate toward when it comes to stress, many of us think of yoga and meditation and think about the effects of that. That's what a calm nervous system feels like. So this is how we go about doing it. And it's quick, it's effective, but we know it takes time. Just like you said, if it took time for the patterns to get there, it's going to take some time to rewire that neurology. And so it's
Yeah.
done so safely, gently, but it will give you the same effects of what yoga and meditation is, which is
Yeah.
really cool.
Yeah, we're trying to get your body to adapt better, right? Because if you're up there on that stressed out side of your nervous system and you're at kind of like your max and your life throws something else at you, you can't handle anymore. So being able to balance that system better so you can kind of go one way or another as time and as life comes at you, that's key. That's how your body heals.
Yeah. So we wanted to just put the invitation out there because you're obviously on this webinar. Either maybe you're already a practice member and you're just looking for just more information, just ways that you can go about things. But maybe you are new to us. We are. I don't know if we mentioned this. We're Lifetime Health and Wellness.
We are chiropractors
in Naperville, Illinois. So some of you may be tuning in out of state. And the cool thing is we're well connected in the chiropractic community. So we are able to find other providers, other chiropractors that practice in a similar fashion that we do, that use scanning technology, because it's hard to know how to help someone when we're talking about customizing and personalizing care, because none of us have the same lifestyle and stress. So these other providers that do the scanning technology, where it's going to reveal, where maybe not necessarily damage has been done, but just where just like things have just been hit for so long. And then being able to monitor that, because baseline is good, but then we need to have checkpoints along the way. And whatever your goals are, that's where you can get a lot done with a committed, specific pediatric chiropractor. So we hope that you will reach out. This doesn't need to be the time of trying to be the hero and trying to take it all on yourself as a parent or as a teen.
You already have enough on your plate,
Yeah.
let's be honest.
Yes, for sure. So please reach out. Feel free to direct message us. If you are local to the area, we would encourage you to come in and just get scanned, at least to see if what we do maybe can even help move the needle a little bit, because it just needs to start somewhere. And we would love to work with you and be able to connect you with wherever you need to be.
Exactly.
Yeah. All right, guys. It's been fun.
Thanks for being here tonight.
Talk to you soon.
Bye.